Dr. Poonam Alaigh is our medical expert here now to talk about the Affordable Health Care Act. We welcome you back to the show. Always good to see you.
Yeah, great to see you, Laura.
All right, so we've been talking so much about what this means for businesses, but what we haven't really addressed is what does it mean for hospitals and for patients?
Well, that's very interesting. The hospitals, for instance, are going to get impacted by this. In general, there are various kinds of reports that are coming out in terms of what the bottom line impact is going to be, and they're mixed reviews. I have a feeling that at least for the safety net hospitals, the hospitals that are in the urban community, they're going to be getting impacted the most.
All right, so they're going to see an influx of patients.
Absolutely.
Are they prepared?
They're going to see an influx of patients that are paying patients with Medicaid, so the newly insured patients. But at the same time, the reimbursement system is changing. So reimbursement is going to be based on value-based purchasing, which is on objective measures of quality and patient satisfaction.
All right, you kind of lost me there. What do you mean by that?
It means what the patients feel in terms of their experience, how satisfied they were with the care, and also what the outcomes were. So if I got admitted, for example, with heart failure, how my care was around heart failure, and did I get readmitted in 30 days for my condition? And if that did happen, I have the potential of not getting paid as a hospital for that patient.
So there's higher level of accountability that's going to be placed into this act. I don't think many people realize that.
Yeah, and this is very timely, our conversation, because there was a study that was released last week that talked about the fact that the safety net hospitals, or the hospitals in the urban community, are the most vulnerable ones, because when you look at their patient satisfaction scores, they're lower than the non-safety net or the suburban hospitals. So not only will they get an increased influx of patients, but they're going to have to dedicate resources to make sure that the patients are getting the high quality care that they can measure and report on.
All right, but could there be an issue of the urban hospitals, perhaps people are not understanding how to fill out the forms, or they're not understanding the process? I mean, is there some type of disparity here when you talk about suburban and you think suburban wealthier versus urban poor?
Absolutely. Those are going to be issues that the hospitals will have to tackle. And so even the kinds of people that they're going to be employing, the staff, the professionals, are going to be different. They're going to be professionals that know how to understand how to understand patient behavior and help with the health literacy or illiteracy issue that's occurring. And how do we come up with solutions around healthcare disparities and dealing with multiple ethnicities that are coming into the system?
All right, well, what about undocumented individuals that are coming into the situation? You know, how do the hospitals deal with that? Who's covered, who's not?
Yeah, and that's going to be an issue, because right now, about $20 billion is given in the form of various kinds of funding, including something called DISH funding, into the safety net hospitals.
DISH funding means what?
The disproportionate share hospital funding. And so that funding is going to come down as a result of the Affordable Care Act, because you're going to have more insured population. However, the analysis shows that about 11 million people are still going to be undocumented immigrants. And so care will still have to be rendered to that population. And so whether it's the feds or whether it's the states or a combination, some kind of resource allocation and appropriation will have to be done in order to make sure that that funding is available for that population.
People are out watching, and they're curious about business, curious about the hospital, but they want to know, well, how's that going to affect me as a patient?
I think as a patient, there are changes that you've seen already, and most of the changes are around the insurance policies. So in the past, if I had, let's say, cancer or heart disease, there was a good likelihood that this was considered a pre-existing condition, and the insurance company would not provide coverage for that condition. So I could be denied coverage. Under the Affordable Care Act, the clause of pre-existing condition has been eliminated. So no matter what condition you have, what chronic disease you have, the insurance company cannot deny you coverage. The other big thing that you're going to be seeing is the preventative care. We all want a healthy society. And if I have to pay out of pocket or a deductible, chances are I won't pay it for my wellness visit or my screening or my immunization. So what's happening under the Affordable Care Act is that all preventative care and wellness care, wellness visits are covered with $0 copay, $0 out-of-pocket expenses for patients.
I think that segues into then how are doctors affected by this with the preventative care if people aren't going there? How are they impacted?
Well, with physicians, if we have a one-on-one conversation, they like the fact that patients will now have access to care. We've all had patients that have been struggling with decisions that they've had to make as a result of chronic disease, around catastrophic disease. So they like the fact that patients will have access. However, from a practical standpoint, they're concerned because, again, there's the risk of reduction in payments, a risk in terms of building more accountability. There's a risk in terms of having something called the IPAB, or the Independent Payment Advisory Board, that's going to look at the fiscal health of our healthcare system and potential for cuts. However, at the same time, there's that opportunity to come up with innovations, novel ideas and approaches to dealing with the issues in our healthcare system.
So it's a whole new world we are about to enter, and a lot to learn along the way. Dr. Poonam Alaigh, as always, it's a pleasure to have you here.
Yeah, it's great being here. Thanks, Laura.
Thank you.